So I was healthy, young person, 21 years old, went to an HIV clinic in Greenpoint, close to Sea Point in Cape Town. Out of curiosity, I went for my HIV test and was tested by a counselor. And during the process of the test, after the positive test was established, I then asked, so what are the next steps? And the next steps were I must live positively. And basically what that meant was that I need to look after myself in terms of what I eat, because that was what was prescribed at the time. They said, no, there is no treatment, unfortunately. Many people, as you would see, and I thought everyone who comes to this thing gets to be told, you have HIV, go home, there's nothing else to do. Basically being told you must go and die. They said, no, there is no treatment, but there is a clinic, pilot clinic in Khayelitsha by MSF. It only accepts certain, so there is a vetting system, certain people, and they won't take anybody just by walking in terms of access to treatment. So I can't just jump the queue just because I tested positive. So when I went to the MSF clinic 3 months later, eventually, after I woke up out of depression, I didn't die. And I realized I'm not dying anytime soon. I might as well try. I went to this clinic and met someone from the TAC. I won't mention her name because she's no more, and for all other reasons, I can't mention her name, but she was openly living with HIV, and she walked through this whole journey of being in an HIV clinic, tried to help me with my own internalized stigma of the condition and the fact that I didn't expect to end up in an HIV-only clinic. I thought it was a normal clinic. It was hidden at the back of Site B hospital, day hospital. So the main day hospital was at the front, and I had to go through the day hospital to go to the HIV clinic at the back. That on its own meant something. Everybody knew who was going at the back, and I wasn't like, I thought, people won't see me, and I was scared that if they do see me, because I was highly conscious and hyper vigilant about my own status. But I think, being handheld or accompanied by someone from TAC really, for me, saved my life, because she took me into a network of other people who were in my same condition, who had no treatment, who were fighting. They were not feeling sorry for themselves. Yes, stigma, we carry stigma all the time, but they were not feeling sorry for themselves to a point of arresting themselves and dying in their stigma. More, they were using their anger and to feed their fire and their spirit to fight. It wasn't a matter of treatment wasn't available. It was a matter of treatment was not available. So that was a different conversation, which again, I didn't know. I would not have known if I wasn't in that space. In fact, I didn't even know that treatment was available in South Africa. I thought it's only available to those in the high income countries or rich countries. It wasn't for the African. I didn't know that even rich people in my own country were living longer than poor people like me. That's when I made those connections, that this is an issue of violations of human rights in all aspects of it, violation of my equality, my right to dignity, even dying, choosing to die with treatment, because the Constitution guarantees my right to dignity, die with dignity, at least, was in practice in terms of policy, it was not protected. So we always read something and would apply it and see, can this work in South Africa? And how many women would benefit, and how many lives can be saved? How do we then translate this into policy? What could be the implementation challenges of this choice? We would analyze everything, costing everything. And in those groups, there are lawyers. We ask the lawyer, so by law, if government can refuse to do this, what could be our legal standing? What could be our argument if we were to go to court? Can we win it if we choose this route and that route? We were privy to those conversations. But all of that gets too complicated and too technical. We then, after sitting in those groups, trying to ask all the questions you ask, we then take it back to the level of the ordinary members. We sit down together and say, okay, if we were to go and explain to communities, what does this mean? how would we explain it in our own language? What are the examples and the songs and the poetries and the dancing that we can use to drive this message? And a lot of it was driven through songs. A lot of it we did it through dancing. A lot of it, we did it through workshops. We sometimes had to do street art and street theater, mural painting, to make sure that the message is shared out there. We sat down and we read. We read, asked questions where we didn't understand. We asked doctors from MSF, come and explain again. We don't understand this and we can't explain it to other people. We need to learn to understand so that when people are asking us questions, we know how to answer. And also, if it's a question of law that we feel like, okay, can I challenge my nurse when they don't give me medication? How can I challenge my nurse? And then we bring in the lawyer. Can you explain to us, if you want to challenge government with this and this and that, can you challenge it? Because in the Constitution, there is no application. It just says you have a right, you have a right. But how do you know that this right is applied this way in practice? How do you challenge it? And then you get to know about guidelines and all of those things. So that's how we learned about the science at branch level. We read every article, we read every booklet cover to cover. It allowed us to be politically conscious about our conditions. It also allowed us to know that science doesn't belong to the scientists only. Scientists in the sense of doctors and the lawyers and the nurses. It belongs to the people. We took it and we made it our own. We didn't just recite their cryptococcal meningitis. We changed the name into something else that resonates with the community. We also used it to empower ourselves and our community, and we used it to assert our power to the corridors of power, meaning government and private sector, that we're using this notion that we don't know what we are talking about. And it also allowed us to build bridges between service providers, meaning the nurses and the doctors, because now they were seeing, highly educated patients who are not just sitting there waiting, yes, doctor, yes, doctor. These are patients who are asking questions. Why are you giving me this pill? What's wrong with me? Have you tested this? Have you tried this? Because I'm feeling this and that. So that also helped the doctors to feel, oh my God, finally we have active patients. It's not just passive and they're just receiving. And it builds our social power because, people knew when the TAC folks were coming and they had to prepare and people had to know their stuff because we were going to ask the hard questions. I think that's a lesson that, when patients themselves are empowered, they own the road and the path to recovery and health. It's not owned by someone else. It's owned by you. And I think that level of mass education for people can never be underestimated in any global health intervention or even public health intervention in countries. That can never be underestimated. Mass education is a must because then the population itself can help itself to do health promotion, mobilize, get people to go and take up services, support each other. And that was all part and parcel of what we were doing. For me, personally, it is what saved me. It is that knowledge that one day I'll be alive, one day I'll take my treatment, I know what I need to do, and the treatment is available. While it's not available, I need to fight for it, and this is the reason why I need to fight for it. That information on its own saved many lives. Just knowing that you can be alive, and this is what should happen if we do get to win policy change.